discuss meningitis. Let's see what it is. Meningitis occurs globally, but is worse in some places than others. This disease is very serious and can kill. However, it can be treated so that people do not die. Meningitis is inflammation of the meninges, which are the covering of the brain and the spinal cord. It is most often caused by bacterial, viral, and fungal infection. This disease is common in children, and it may begin as complication of other diseases, such as measles, mumps, malaria, or even as an ear infection. Community health workers, parents, and carers can all play a role in reducing the number of deaths caused by meningitis. It is important to look for any of the following signs, particularly in infants and children, but remember that meningitis can also affect adults. A high fever is a common symptom and can be accompanied with vomiting, severe headache, and a stiff neck where the child looks very ill and lies with his head and neck bent backwards. In babies less than 1 year old, the soft spot on the top of the head, known as the fontanelle, may appear swollen, known as bulging fontanelle. Sometimes a child suffering from meningitis may also experience fits or convulsions. At the late stage of meningitis, a rash may be visible on the child's skin. If you have a glass available, it is possible to do the tumbler test. If the glass is pressed firmly against the rash, it will not fade and will remain visible through the glass. If this happens, you must seek medical advice immediately. But remember, you must also be aware that a rash does not always appear in a sick child or adult. Sometimes early meningitis can be hard to recognize, but the child may also cry in a strange way, even when the mother puts the child on her breast for feeding. The child may be unusually sleepy and unresponsive. Often the children get worse and only become quiet when they lose consciousness. In other children and adults, you may notice that they dislike bright lights. Not all of these symptoms will appear. Even if just one symptom appears, you should take the situation very seriously and act as soon as possible. Remember, meningitis can kill. Treat appearance of any symptom very seriously and seek medical assistance immediately.
Meningitis is an illness that can be very scary. It's an infection that can make people very, very sick. Babies who get the disease are at particular risk of getting dangerously ill because it can be tricky to diagnose and symptoms can escalate quickly. More on how to recognize and treat meningitis from Mayo Clinic.
Very smiley, very happy kid.
That sums up little Jimmy Morse. But when symptoms of meningitis hit, he became very lethargic.
He had a very high temp, 104.5 under the arm, and he was making a lot of moaning noises and just was not with it and wasn't acting like himself. And he had a rash, like a little bit of a reddish rash on his stomach.
Since Jimmy's a baby, he couldn't tell anyone if he had two other telltale signs of meningitis, headache and stiff neck.
So meningitis is inflammation of the membranes around your brain and spinal cord.
Dr. Ritu Banerjee says meningitis can be caused by viruses or bacteria. Bacterial meningitis is more severe. The bacteria that cause meningitis typically live in our nose and airways. In rare cases, the bacteria can get into your bloodstream or meninges, which are the membranes surrounding the brain and spinal cord. Left untreated, meningitis can cause brain damage and even death. So, it's vitally important to get emergency treatment fast. Jimmy did. His parents took him to the emergency room where doctors diagnosed him with bacterial meningitis. He was admitted to the hospital and stayed for 7 days as he received IV antibiotics. When Jimmy got home, he continued oral antibiotics for 5 days. Jimmy was very lucky. He recovered from a very severe case of meningitis.
I think it was even more scary when the doctors started telling us that he must be destined to do something in this world because most kids don't make it through.
Back to his happy self after battling bacterial meningitis. Dr. Banerjee says the best way to protect against bacterial meningitis is for children and adults to get routinely recommended vaccinations. And to prevent viral meningitis, wash hands often, don't share utensils, do the same things that help prevent cold or flu. For Medical Edge, I'm Vivian Williams.
Serious infection of the fluid that surrounds the brain and spinal cord.
This is a really easy case, but we'll do it anyway. Notice here's the brain. Notice these delicate little membranes here are the arachnoid mater. Notice that the meninges are very cloudy along here and appear to have a thick, perhaps almost a pus-like exudate. Actually, it is a pus-like exudate. This is swelling of the cloudy swelling of the meninges due to acute inflammation of the meninges, otherwise known as meningitis. I'm going to go out on a limb here just to make your life a little bit simple. Whereas most primary inflammations of the brain proper, primarily limited to the brain, are caused by viruses, most of the inflammations of the meninges are primarily limited to the meninges, are caused by bacteria. Now, meningitis can extend into the brain and encephalitis can extend into the meninges. And if you did, perhaps you would like to use the word meningoencephalitis to really show that really both areas are involved. But in this particular case, the brain is relatively normal, and it's just the meninges that are very, very much inflamed. They are inflamed because they have these little collections of neutrophils all throughout the meninges. Here's a solid little ball of leukocytes. All of these are leukocytes. This is why the brain looked like pus and the meninges were thickened and cloudy. If this was a child less than 2 years old, perhaps Haemophilus would be the first bacteria on your mind. If this was part of an epidemic, you might expect Neisseria as being the bacteria involved. And of course, in older people, some of the other gram-negative bacteria would be a cause of meningitis. But just as a general rule, most meningitis is bacterial caused. Do a lumbar puncture, and you'll probably be able to figure out which it is if it's not apparent already. Thank you very much.